Community feedback on Lagos Television. My name is Kikelomo Oduyebo. Welcome to the program. Today on the program, we'll bring you an highlight of a medical donation by a non-governmental organization, Save the Children International. The effort is a collaboration with the Lagos State government in improving the available healthcare services in Ikorodu local government area, especially in combating childhood pneumonia among children under age 5. Stay with me on the program after this break for the details. Welcome back to the program. It's still community feedback on Lagos Television, and today we are highlighting a medical donation made by a non-governmental organization, Save the Children International, to Lagos State government, especially at Ikorodu, which is where we are today, to highlight the importance of this donation to improving more healthcare services for children who are underage, especially within the age of 0 to 5 years old, so that they don't die of any infectious diseases, particularly pneumonia. And stakeholders are gathered in this hall to receive this donation. Let's join our correspondent in this package.
World Health Organization says pneumonia is a form of acute respiratory infection that affects the lungs, killing more than 800,000 children under the age of 5 globally in the year 2021, or one child every 39 seconds, according to a new analysis. Nigerian children made up the highest number of those who died, with an estimated 162 deaths in 2018. To prevent newborns and under 5 children from dying due to preventable deaths of pneumonia in Lagos State, a non-governmental organization, Save the Children Nigeria, has been partnering with the Lagos State government in the health sector since 2021 by supporting 27 primary healthcare centers and 2 general hospitals in the Ikorodu area of the state towards quality healthcare delivery, especially to mothers and their children. The effort is to make every breath count under the inspiring project of Save the Children Nigeria, in saving the lives of 1 million children in Lagos State to achieve the Pillar 2 on health of Governor Babajide Sanwo-Olu's development agenda, as well as the Goal 3 of the Sustainable Development Goals on good health and well-being by preventing newborns and under 5 children from dying as a result of preventable deaths through child killer diseases.
Government has done a lot in terms of childhood diseases, not only childhood pneumonia. First, government tried to separate the children and the mothers from the main hospital by trying to create the maternal and child centers. That's what is called the MCC. And so far, I think government has done about 13 of such in Lagos State, and is still doing more of such. At General Hospital Ikorodu, we have very active, vibrant medical doctors. We have about 3 pediatricians, that's the consultant level, about 20 pediatric doctors that actually deals with the children. We have pediatric nurses too, and we have several nurses doing that. And the first thing they do is giving the normal health education to mothers, telling mothers to keep the children very warm, especially during this rainy season, and especially when they start going to school. They should make them warm so that they don't get exposed to pneumonia, which is infection of the lung.
Okay, so
aside from that, government provided a lot of equipment for us as a hospital, provided centralized oxygen. The pharmacy is very vibrant, has virtually all the drugs to treat childhood pneumonias and other childhood infections. And they are done at reduced subsidized prices because from 0 to 5, it is basically free for them, age 0 to 5, at subsidized rates.
Save the Children Nigeria has again donated incubators, infectious prevention consumables, and personal prevention equipment worth 50 million naira, which has been received by the Medical Director of Ikorodu General Hospital, Dr. Taiwo Hassan, who signed the donation certificate attested to by the Save the Children Country's Director's representative, Amaka Ifeunu, in the presence of all.
I want to say thank you to Save the Children. The intervention of Save the Children is very laudable. Government has always preached the private-public partnership, and this is one of such, and it is helping. They gave us, as a hospital, General Hospital Ikorodu, some incubators for the preterm children and children who actually need those incubators, phototherapy machines for the children who are jaundice and actually need those phototherapy machines. And they equally gave us some radiant warmers for the children that needs them, and IPC and residents of Lagos State.
As far back as 2018, when we set out to do this, we thought of what we could do in the states that we had been commissioned to do so, and Lagos was one of those states. And we decided to look at where the needs were and where we would make the most impact should we come in with the resources that we have from our esteemed donor, GSK. And so, working with the state at the Ministry of Health levels and the Primary Health Care Board, we decided on Ikorodu local government as the location to really support and saturate with these services. As I said, the project focuses on childhood illnesses as a whole, using pneumonia as a fulcrum. So essentially, we're looking to work with you all as a local government to support the integrated and sustainable reduction of childhood illnesses in Ikorodu local government.
The Lagos State government official from the Ministry of Health, Mrs. Deborah Afolabi, who witnessed the handing over of the medical equipment to the beneficiary healthcare facilities, said the Lagos State government is pleased with partnerships that would help improve quality available healthcare services in Ikorodu and welcome more of such collaborations.
The Lagos State government really appreciates the Save the Children initiative for this enormous support. They've been supporting Nigeria since 2001, and they've been supporting Ikorodu local government for quite some time now. And here again we are today. They are donating hospital equipment and a lot of other prevention, infection control equipment to the local government. So Lagos State is very happy with them. They asked me to bring a goodwill message of appreciation for all they've been doing for the states. Just as they said that they are going to do more, we are still expecting them to continue.
Also, two members of the Ikorodu communities and World Health Community Chairman thanked the donor for the gesture. They urged nursing mothers to always visit the healthcare facilities whenever they notice shortness of breath, hoarse, incessant coughing, fever in their children, which are signs of pneumonia in children, as awareness on the child killer disease is intensified. Intervention of Save the Children Nigeria in Ikorodu healthcare facilities. According to the Chief Party of Inspiring Projects, Dr. Isa Adamu, has led to the reduction in the death of children under 5 years of age and improved healthcare services to children since 2021.
27 primary health centers in Ikorodu and another 2 general hospitals in Ikorodu. So the idea originally when we designed the project was to do a pilot and see, can we make improvements? Is there a way we can improve the situation with child health, especially childhood pneumonia, in this LGA, if we saturate it with all the things they need? And after 4 or 5 years, we do evaluation and see, has this intervention made a difference? Have we reduced the death among children after this number of years and after this kind of interventions? If the answer is yes, we see some improvement. it means the approaches have worked. And it means we can go back to the donor or back to Save the Children and say, if we get opportunity, we can cover the whole of Lagos State.
Save the Children says if it has more funding, it would extend coverage to other local government areas of Lagos State in improving quality available healthcare services to mothers and children as they continue to ensure the medical equipment are put to good usage for newborns and under 5 children.
It's still community feedback on Lagos Television. At this moment, I am at Itelewa Primary Healthcare Center, one of the beneficiary facilities for the medical equipment donation by Save the Children International. Join me for the details as they share their beneficiary experiences.
The Save the Children, they have done so much for people. And as Father has said, we seek for them to help us. We are under governments. And we have so much, so we still need your assistance.
Save the Children has been so good to us. They give us a lot of instruments to General Hospital, to all our health center, which my duty is to go to the health center to make sure that everything has been used the proper way, to make sure that the children are well taken care of. And in our own community, our CDA as well, I talk to them all the time about pneumonia. Or if I see anybody carrying a little baby, what's wrong with this baby? I will look at it. Please go straight to the health center and see a doctor. Even some of them, I follow them to the health center because they will tell me that there's one Mama Lagbo, there's one Baba that prophet that they usually go. So I said, no, just enter my car. I take them to the health center and I follow them up. I make sure they use their drug. So Save the Children has been supplying us a lot of instruments, materials, including now they are giving us incubator, mobile incubator. So we pray that God will continue to be with the sponsor.
Wọ́n ṣe gudugudu méje yàyà mẹ́fà nítorí ńgbà tán dé wọ́n tẹ̀lé àwọn health workers wa lóríṣiríṣi náà bẹ̀rẹ̀ sí donate. I dey make sure like myself all the time mo lọ sí PAC tí mo lọ ń wo bí àwọn workers ibẹ̀ ṣe ń ṣe tí wọ́n bá ṣe nǹkan tí ò bá correct màá sọ fún wọn pé nǹkan báyìí ò correct báyìí ló yẹ kẹ́ ṣe báyìí ló yẹ kẹ́ ṣe.
That's our package today. I hope you enjoyed it as much as I did. Stay safe and see you next time.
This is Lagos, you know we love it. This is Lagos, you know we like it. This is Lagos, you know we love it. This is Lagos, you know we like it. This is Lagos.